So we're going to kick it off very quickly. I want to introduce a couple people that are here, just so everybody knows who's in the room. I think it's very important during a town hall to make sure we all know who's in the room that's going to be listening. The first person I have is, of course, the chairperson of Disability Pride PA, who's always very important to make sure that he is part of these conversations. And that is Chuck Horton. Chuck, will you introduce yourself quickly?
Hello, everyone. My name is Chuck Horton, Charles Horton. I am an African-American male. I have on a charcoal shirt that Disability Pride, and it says Disability Pride Virtual 2021. I have locks. Some people call them dreadlocks. I would call them locks. I have a salt and pepper beard. I'm more salt than pepper. It's getting ready to be totally white. Hey, it happens. And I'm almost a brown complected black male. And I'm in front of a tan wall with my name Chuck on it. I love my name. But and welcome everyone.
Thanks, Chuck. We also have with us Amy Matheson Millar, who is the new executive director for the Mayor's Commission on People with Disabilities. Hi, Amy.
Hi, Vicki. Thanks for having me today. I am a middle-aged young woman with fair complexion. I have dark purple curly hair to the side and dark black cat eye glasses, and I'm wearing a black and floral vintage dress. I am the newly appointed executive director for the Mayor's Office for People with Disabilities for the City of Philadelphia. Just really quickly to give you some insight into what that office does is that our office oversees the Mayor's Commission on People with Disabilities and the Office of ADA Compliance. And together, these two offices help to ensure those with disabilities have equal and equitable access to all facets of their life and our city. We look forward to hearing your experiences today and ways that we can better support access in Philadelphia for all people.
Thanks, Amy. We also have a few other people here that I want to make sure that we say that we let you know are here in the room. We also have Adrienne Ewing. Adrienne, would you like to turn your camera on and say hello? She is the City of Philadelphia ADA coordinator.
Hello, everyone. I can't turn on my camera right now, but my name is Adrienne Ewing. I am the ADA coordinator or the director of ADA compliance for the City of Philadelphia. And I work with Amy Millar, who is our executive director. And I have been working on the completion of the ADA transition plan for the city. And we have been focusing on that to make our city more accessible. So thank you for this opportunity.
Thank you. So now what we're going to do is I'm going to turn my camera off, and Amy, you can turn yours off now. And what we're going to do is we're going to make this available to our speakers who wanted to say something. The first person we're going to call on is Samantha Petty and Willa Petty. Can you please turn your microphones on and your cameras?
Hi. Willa is a 7-year-old, and she has pigtails, and she is white and talking on a communication device, and I am her mom, and I am also white, and I have a ponytail and glasses and a blue shirt. I've never been to this before, so going first, I'm not exactly sure what the usual topics are, but I can.
So all we would like to hear is for your experience and how you're feeling about access in the city for yourself and your daughter.
Okay. Yeah. So we were been in Philadelphia since my daughter was a baby, and I think as she's gotten older, as a wheelchair user and someone who has complex needs, a lot of the services that we'd been able to use when she was a baby just no longer accessible to us. So we live in West Philly, and we keep waiting for the new accessible trolleys to come, but they haven't come yet, and we had a really hard time finding accessible housing, but we did. And I think it mostly just took a lot of money that we didn't have when we moved here, and a lot of Philadelphians don't have. So it shouldn't take so much money to just find normal accessible housing. So that was like one big concern. And then so far, our rec center is not accessible, and our nearest libraries with the best kids program are not wheelchair accessible, and our neighborhood school is not wheelchair accessible. So in many ways, we're kind of locked out of our neighborhood. And then the other issue we have a lot of times is my daughter gets shift nursing. And so the shifts are 10 hours long, but our parking out in front of us is 2-hour parking. Will is hoping that her school friends might be on this Zoom, so you might hear some of their names. Are you looking for your friends? So anyways, so if one of us is not home, the shift nurses have to either decide between getting a ticket or leaving Willow alone to go move their car. And I did write my city council person about it a couple of years ago, but didn't hear anything back. So I kind of gave up on that. But I think one of the ways we'd like to live in community is just be able to have the people who come in and work comfortably be able to park and come help my kiddo. And the other thing we've been really hoping for is the bike share is right by our house, and we moved here from Portland, Oregon, and we had adaptive bike share bikes there that we could have used, and in Philly that hasn't been part of the bike share rollout, so we've been quite hopeful that there might be an adaptive bike share that we could use too. And then when we were deciding on which school my kid could go to, when our neighborhood school wasn't accessible, I thought about, one of the things I thought about was just needing to pick her up to go to doctor's appointments. And we had a really hard time finding a school that I could easily take her on public transit. Are you looking for Linkson? Back to the doctors, because I can't switch at the Broad and Market Street line with her north to south. So that was pretty limiting for our school options unless we wanted to use CCT for every trip between school and the doctors, which is fine, but just takes a lot more organization than me just jumping on the normal transit lines. So that's kind of where we're at. There's some really cool stuff happening in our neighborhood. We have an adaptive dock that just got built at Bartram's Garden that we're really excited to hopefully use for some boating activities. And we are sort of trying to be involved in the Carousel House closure to see what's going on with that. So that's kind of where we're at with access today thus far. Thanks for hosting this.
Oh, thank you. Thank you for agreeing to speak. I think, that is why we're here. It's super important that people are here and that we are talking about access in the city for everyone. My next guest is Morgan Hugo. Morgan, will you turn your camera on? Oh, there you are. Good morning.
Hi, so I do have a barking dog who is lying on the couch right now. So you might hear a bark in the background. My name is Morgan Hugo. I have brown hair that's in the ponytail. I am Caucasian, fair complexion, and I have glasses on and a blue shirt with bumblebees on it. I am an independent living specialist at Liberty Resources. And I am also the coordinator of the One Step campaign at Liberty Resources. So I myself and also my wonderful coworkers work to make businesses accessible in the city of Philadelphia. We do this to businesses that are easily able to become ADA accessible, usually a step with like 6 inches or less. And it's one step for a reason. And that's because we believe in full inclusion for people with disabilities in Philadelphia. The difficulties that I have in general is many times L&I approves of businesses to be built or change of zone or usage without requiring them to be accessible for people with disabilities. Many times businesses as well seem to be rather patronizing. Well, we don't have any disabled people here, so why do we need to make it ADA accessible? When we also bring up the lawsuit, and I brought up a lawsuit with a close friend of mine, Eileen Sable, AKA Spitfire, who recently passed away in January. Spitfire's lawsuit took about 3 years to make a piece of place become ADA accessible for people with disabilities. So she could just roll on in and order a slice of pizza just like everyone else. Other difficulties, and again, it took 3 years, and I'm pretty sure Spitfire would have been really proud right now. Wherever she is in a good place, making sure the good place is wheelchair accessible, that she won that lawsuit. Other things realizing right now is streeteries. Very difficult to make sure that streeteries in Philadelphia are wheelchair accessible, as well as are not blocking the sidewalk. Personal story of mine is I live on 9th Street. There is a restaurant on 9th Street, James Beard Award winning restaurant. They were probably not accessible for over 6 months with blocking the sidewalk to pedestrians, wheelchair users, as well as you couldn't even go onto the streetery and eat there as well because they didn't even have wheelchair access to the streetery. Calling 311, making those 311 complaints was really difficult because 311 was not responsive. What I ended up having to do instead was contacting my local city council person, Squilla, putting him on an email, and that's a suggestion that worked for me, is contact your city council people, who helped me connect with L&I that way in the streets department to make sure that the streetery is accessible. So if it wasn't for my contact with Squilla, they wouldn't have been accessible because 311 doesn't do that much, in my own opinion. Other issues Liberty Resources is working on is making sure that taxi cabs are still accessible, wave vehicles, that SEPTA is also fully acceptable, such as a previous speaker was speaking. The trolleys not being accessible is a major issue. Making sure rec centers are fully accessible throughout the city of Philadelphia, as well as nursing home transition to help make sure that folks living in nursing homes who are often there because they can't find accessible, safe, integrative housing are able to transition out safely from the nursing home and find the housing services that they need, as well as those support and services under Medicaid. which is also a fight in itself to get
Right.
for those services. So that's about all I would say. Thank you so much for giving me the opportunity to speak. If you all would like any contact with Liberty Resources, you can look us up online or call 215-634-2000 extension 325 for the information and referral hotline, and one of our ILS specialists would be able to assist you there.
Thank you so much, Morgan. Thank you for all of that and all that you guys do. I really.
You're welcome.
Our next speaker is going to be Jade Ramos, AKA One Ojo. Jade, will you turn your camera and mic on for me, please?
Hey,
Hi.
this is so cool to be a part of this. I've always wanted to, I guess, let people know about certain stuff, but I never know who to tell. So I'm legally blind. I've been born legally blind. I'm also Puerto Rican, so Ojo is I in Spanish, so that's my Instagram handle is One Ojo. But I've lived in Philly for about like 6 years, both in West and different spots in North. And the area I'm in right now is probably the only one I haven't explored because the sidewalks are horrible and dangerous. I use a cane. I get jabbed a lot in the stomach. Not pleasant. So lately I've been taking Ubers and other stuff that's more accessible that way. But I've noticed that buses don't announce a lot of the times, and I don't know if that's like a bus driver thing or what, but it's like to be that hyper vigilant if I accidentally miss a stop is like so nerve-wracking. I want to be able to just chill and rest and not have to worry about like if I think I'm at the right spot but I'm not because it's not announcing it, or if there's a detour and I don't know and it's not saying that like, oh, we're not going down this thing. I try to keep up with stuff on Google, but then that's also I can't do that and be on the bus at the same time because I get motion sickness. And people not moving when I like it's like, oh, if there's a bunch of people in the handicap seats, you don't know who's disabled, you don't know who's not. If I have my cane, people will pretend to like, I don't know, stay there but like not move as if like, okay, they're sitting still, I'm not going to notice them. So maybe I won't sit there. You know what I mean? Like they don't actually move and get out the way, even though it's prioritized because I look young and I guess people think, you can't have issues. Because I also have mobility issues and it'd be easier to just stay at the front of the bus by the bus driver so they could like let me know when we're at the spot, maybe help me off the thing if I need to. But lately, because of COVID, I find it even more difficult than normal because now where before it'd be like, oh, if I stood somewhere for a decent amount of time, maybe somebody would then move to let me sit there, or somebody would get someone else to get up, I guess, if they, see that they don't look a certain way and think that they don't have a right to be there over me, a blind person. But now it's like, oh, the lack of help is way more, plus the wearing of the masks are like, now people, before I feel like people would ignore me, but now at least I could like, I don't know if they're actually doing that because I can't see their facial expressions or whatever through the mask now, or if they have sunglasses on and stuff. Like, so things have been a lot harder navigating stuff throughout COVID and traveling on the train too. Even like, there's just so many things that SEPTA, they got rid of at the train station. They got rid of a lot of the signage that like happens before you go into where all the tracks are, and I have to walk all the way down to like the third track to maybe be able to catch a glimpse of all of the what time my train leaves or whatever. Before I used to be able to do that without having to get on the track, and now I have to actually get all the way on the track to then see maybe it's a 20-minute delay, and then I got to walk all the way back down, where I don't know why they got rid of that. And it's been very disorienting and stressful having to like navigate that, but also not want to miss a train, but also need some time to go do some things. And Google again doesn't update with that stuff. But the main issues, yeah, I would just say is probably, yeah, the sidewalks definitely have to get fixed. I don't I've every neighborhood I've lived in, I've had issues with that. So it's not even like, because at one point I lived near Drexel, and that wasn't that bad because I guess there's a lot of college kids there. But most places, like the sidewalks are horrible. Um, I would love to have like a scooter or something, you know. I don't feel safe doing any of that. So I didn't even know they had accessible bikes. So I hope that could happen in West Philly and other places around the city. That'd be so cool. Maybe I'd feel safer riding in a lane, but you know, cars and buses, they're wild. And I don't know. I just wish people were nicer at times. I feel like my social anxiety has gone up a lot during the pandemic, so I've barely left the house even when I probably should. Uh, and but I am traveling in 2 days, so hopefully I went home a couple weeks ago to go out for my niece's first birthday, and luckily I didn't need to travel all the way to New York by transit, but even traveling to North Jersey was like a hassle. So I hope now that restrictions are lifting and things are changing somewhat, that it'll get slightly easier compared to what it has been. Because yeah, it's hard standing in a spot at a train station for an hour because they closed all the seats off.
Right.
Sit anywhere, like,
Yep.
yeah.
Well,
But
thank you so much for that. I really appreciate it. You know, this is why we're here. This is, you know, we need to have these conversations. So I really appreciate it. I'm going to call on our next person. You know, before I do that, I have a comment that somebody asked me to read. So I will do that very quickly. This is from Teresa Yates. She says, I am an African-American woman with cerebral palsy. I'm the vice chairwoman of Liberty Resources. I live in one of the Philadelphia Housing Authority's scattered sites. The building is a duplex turned into 3 apartments. My apartment is on the first floor. However, I have a stair lift to get into the building, and I'm having a problem with the neighbor's trash blocking the access to my stair lift to land at the bottom and blocking me from wheeling off the lift without my attendant moving everything. The issue was supposed to have been resolved 6 years ago by keeping the trash inside. Now that the pandemic is subsiding, I'm going to be getting out more. It's not fair that I don't have easy access to my building like my ambulatory neighbors. And that is from, again, Teresa Yates, who is my friend and I miss very much. So the next person I believe we're going to call on is Lauren Alden.
Hey, Vicky, thanks. Sorry about that.
So much.
Hi, everyone. My name is Lauren Alden, and I work with Morgan Hugo at Liberty Resources in the Independent Living Services Department. And really, she was able to capture a lot of what we do and what we wanted to talk about. So I'm just here to say thank you for having the town hall. I know that, you know, Liberty was able to have a separate meeting with a lot of the folks that are listening here about the issues that we have with accessibility in the city. And we're thankful for that meeting. And so just to reiterate a little bit of what was discussed then is that, you know, we know the ADA plan is in the works, and our biggest thing is, you know, it's been about 30 plus years since the ADA passed. And so we don't want to wait another 30 years for for things to become accessible in the city. It's been a long time. So we're really looking forward to see how quickly the plan moves forward. And so I wanted to thank the ADA coordinator who was able to meet with us before as well. And then the only other thing I guess to mention briefly is just the rollout of the vaccinations for homebound folks with disabilities. We were just hoping that the city could have moved a little bit faster on that, given that they had the information of how many folks were homebound and needed vaccines at home. I personally just checked 311, a while ago to see if I could find out information about that. And I got hung up on twice, not hung up on, disconnected, excuse me. And then finally I asked someone to stay on the line with me while they connected me to the COVID resource line. And they did, and they were really great. But the COVID resource line basically just, gave me the resource of the Black Doctors Consortium and Penn Medicine, which were great resources and resources we knew about. But we were, really trying to find out what the city itself was doing to help vaccinate people at home. As a lot of you all know, people at home have attendants who come in, people who are specifically couldn't leave their house because of different autoimmune disabilities, or not being able to wait in lines, being put at a higher risk for COVID. They're exposed to other folks who come in, home health workers. So we really wanted to see them more as a priority in the vaccination efforts. And the city eventually did come around and open up a program to get people vaccinated at home. But as with many other things, it was not a top priority. So, again, I'm grateful for what my coworkers at Morgan, at Liberty do with, just trying to get individual businesses accessible. But there needs to be a lot more conversations about the sidewalks here in Philly and the curb cuts and, issues around when the snow removal happens. So I'm glad we're having this town hall. And I'll let the next person speak. Thank you.
Thank you so much, Lauren. I really appreciate your time today. So what I wanted to do next is I wanted to see if Russell Lash was here. I was hoping he was going to get to sign on, but I don't see him, unfortunately. So what I'm going to do is I'm going to open up the floor very quickly. Oh, somebody just said they wanted to speak. So why doesn't Cecilia Thompson turn her mic and camera on and she can speak?
Give me a minute, I'm coming.
No problem.
Let me fix something real quick. Sorry, I didn't know it would be this soon.
That's okay.
Okay, I hope everybody can see me. My name is Cecilia Thompson. I use the pronouns she and her. I'm African American, middle-aged female. I have a scarf on and a black scarf and some earrings. And what I wanted to speak about in terms of accessibility is accessibility for individuals living with ID and living with autism. While I have my own mobility issues and challenges, and the apartment that I have is for, for people like me that needs the accessible bathroom and those kinds of things, so I can live and experience independent. Want to expand the conversation of accessibility to those living with severe autism and ID. I'm the mother of a 22-year-old. We do have a waiver and he does require 24-hour support, but because of his particular journey on the autism spectrum, he makes a lot of noises. And our apartment is not soundproof, but me and the support person, we try to get him together. So, maybe today he's not screaming at the top of his lungs for 30 minutes. Maybe we can only get it down to 15. But when you have an individual on this type of journey, some of their things with him is the noise making, or he used to headbang. Thank goodness he's stopped that. And that can be very, disconcerting as a parent, because you don't want people to look at you strange when you try to go to a restaurant. When it comes to activities, he always has to have somebody with him. And accessibility for him would be, if he does make a noise, people not looking strange. Because when we do go to restaurants, we only go in the afternoon when there's not that many people there. We did a restaurant at 5 o'clock and that was a disaster. We had to just leave. So it's not a lot that he can do. We have to plan everything. If we go to the movies, it's the 10 a.m. or the 11 a.m. movie on a Tuesday, where it's only maybe 4 or 5 people looking at that movie. We sitting way up in the back, and I have the support person there just in case somebody doesn't know what's going on. He's the one that goes down and smooths the waters, so that we can, try to get through a movie. So we can't go a lot of places because of my son's behaviors. We can't do a lot of things because of his behaviors. And even this with Special Olympics, I had one person write me a letter saying that because of his behaviors, he can no longer participate in Special Olympics tennis. That went left because I had that published in the paper, and we finished tennis, but we just never went back to tennis. But he does participate in other things where they are more understanding of his disability. So, he's depending on who the adult is, can't even participate in Special Olympics. Or when I testified yesterday about the carousel house, even the carousel house, I'm glad, people with physical challenges have a place to go, but we were even denied. And because of my fortitude and due diligence, we went to a couple things throughout the years, but there's not a place for individuals with autism and ID to go in terms of the public rec system and do something recreationally, unless the adult who's the site coordinator is autism or ID friendly. So that's all I wanted to introduce into the conversation, that we widen the term accessibility to include individuals like my son, who has little verbiage, and his behaviors are severe, unfortunately, but he always has a support person so that he can be included, and hopefully one day he'll have some sense of independence. Thank you for the opportunity to speak. And I wanted to know, could I put my email in the chat for the young lady that had problems with the school district? Because I'm not here on that behalf, but I just happen to sit on the school board, and I wanted to be able to help that young lady with her concerns.
Absolutely. Thank you so much. I really appreciate that.
Thank you.
So next, we are going to hear from Igor Kamel, and I probably butchered your name, and I so apologize.
That's okay. Hold on just 1 second. Hi, everyone. Good afternoon. My name is Igor. I work for Liberty Resources. I'm an advocate there, an advocate for the deaf community. I wanted to talk about accessibility for deaf people and interpreter services. We need some type of VRI access for the police and for the banks here in Philadelphia. If people are trying to purchase a home or something like that, they need access to interpreter services. Also at places like the Verizon store or the T-Mobile store, places where deaf people need to go in and communicate, we need VRI services. Also in the SEPTA offices, we need accessibility there as well. So VRI would be a good way, video remote interpreting would be a good way to provide that access. Also, family doctors should also have access to video remote interpreting for any type of a last-minute appointment scheduled by a deaf patient, but preferably they would have an in-person interpreter for any appointments with advance notice. But at the last minute, sometimes there are no interpreters available to be on site. And if the deaf person has an emergency and is ill and needs to see the doctor, we need VRI services available there as well. Also, the television and nightly news. At like 7 o'clock, it'd be wonderful to have picture-in-picture interpreter services available for that, as opposed to just captions. And we don't need to have the person there on the screen with the newscaster, but we'd like to have the picture-in-picture so that we can watch the interpreter. So we'd also like to have some type of program available where for Children's Hospital or at the doctor's office, when a child is identified as deaf, that they're not automatically consulted to get a cochlear implant, but that they're exposed to all of the options that are available, including using American Sign Language to communicate with their child. So typically you can go online as well and you can find a primary care doctor and you can find ones that are close to you, and they typically have the languages listed that that doctor is able to communicate in: English, Spanish, Russian, whatever it might be. But I never see any doctors that are able to communicate in American Sign Language, or that American Sign Language is even listed as an option on those sites. And we'd like to see that available so deaf people know where they can go and have communication access with their doctor. I think that's all that I have to say for today. Thank you.
Thank you, Igor. I really appreciate you coming on and speaking. The next speaker that we're going to hear from is Dustin Kidd.
Hi folks, I'm Dustin Kidd. I'm a white middle-aged man with brown hair, glasses. I'm wearing a Disability Pride PA purple hoodie, and I'm sitting here with a gray cat named Baby Bear. I speak from a couple of perspectives. As a person with disabilities, I'm still learning about my most recent disability, which is diagnosis of epilepsy that I've been experiencing for the past few years. So I'm still learning how that impacts my accessibility around the community. I'm mostly anxious to learn what happens when I have a seizure out in a public space. But that hasn't occurred yet. So but I also am here as a professor at Temple University, which identifies as Philadelphia's public university. And I think we have a long way to go towards really being a public university for people with disabilities.
Yes.
So I think we need more conversations with our community about who is applying and who's not applying to Temple, and how we can increase accessibility at Temple for all types of disabilities. I've taught in classrooms that I don't think can count as accessible classrooms, and I think we have to have a lot more training in universal design of our curriculum. So I'll leave it there. Thank you.
Thank you, Dustin. I really appreciate you.
Thank you, Vicki.
All right, so is there anybody else that would like to say something? If you raise the little raise hand emoji. I can, it's easier for me to see you than trying to run through all of the important chat that's been going on today. So let me see, Sudan Bradley.
Hi, good afternoon, everyone.
Hello.
Hi, my name is Sudan Bradley. I'm just here appreciating all the information that I am receiving as a sponsor, but also as a mother. I did want to reach out to Cecilia Thompson. I think that's your last name, sorry. I am a mother of a child with that's on the spectrum as well, and I have the same issues. There are some events and some things that do happen. I do have a friend that started a nonprofit, which is called Motherly Autistic Care, and she has she hosts events throughout the year for children to be themselves. So that may be a resource for you if you want. I can put her Facebook and I'll put my contact information in the chat if that's okay with you, Vicki.
Absolutely.
For just to brainstorm some new things, because I do have the same issues. My son is actually, he's becoming verbal. He is starting to speak. He's only 5 years old. However, he does the same things he does. He bangs a lot at times, and you do get, I try not to pay attention to the looks because people just are not aware, don't know, and they assume he's just throwing a tantrum or something. But I know when he gets older, those are things that I have to look towards. But there's certain, it's just unfortunate that my main issue is those organizations and those facilities and businesses that don't want to accommodate or don't want to understand and try to say you have to leave or quiet down or something in that situation. Like I said, Motherly Autistic Care, there's some other organizations that are starting or that started that are trying to be more accommodating, to have a place or a safe place to go for children with autism. I actually work with individuals with hearing loss. So we provide technology, telephone technology for individuals with hearing loss, such as the caption telephone and other Pennsylvania relay services. So I'm happy to provide any information. We work closely as well with the telecommunications. It used to be called TDDP with Temple University Telecommunications Equipment Program. So if anyone needs equipment for individuals with hearing loss, I know some things may be a challenge to look forward to or see or get, but I try to gather as much resources as I can for anyone with any disability, just so I can provide that information, whether I'm working in that arena or not. So
I appreciate that. Yeah, I am a person with hearing loss, so I'm really appreciative of all of that. I do have your contact information, so here is looking for those kind of resources, and you don't have Sudan's information, then please reach out to me. You all know how to reach me, and I will make sure that that happens.
Absolutely. Thank you, Vicki.
Thank you so much. We're going to hear from Debbie Cherry.
Hi, I'm a white woman with dark shoulder length hair, and I'm wearing a Disability Pride Virtual PA t-shirt. I live in Pittsburgh, but my family is in Philadelphia. And I have two things I want to bring up. Before the pandemic, my mother had difficulty finding a way for my cousin who lived in a nursing home in Chester County to be able to come visit, especially for gatherings, cross county. It seemed that all the accessible transportation options that would take her were limited by county borders. that she could find. And that didn't seem to be a consideration that people from Chester County might want to go into Philadelphia County. She's in Center City. So whether she was not able to find the appropriate resources or not, I don't know, but that was certainly one of the things. My parents both had mobility and hearing limitations and use an aid. And in December, they got COVID. And when that happened, I was desperately trying to find, and then their aide also tested positive, not surprisingly. I was desperately trying to find some way to get help for them because I was sure that they would need additional help during that time, and was unable to find any real resources, both in general that would help find them one. And of course, most of the services, home healthcare services were not taking COVID patients. So it was really on our own to find help for elderly and disabled people who had COVID, and it was, oh, well, good luck. And there was really not any assistance. So it was really one more area that things were lacking in terms of COVID response of how do people who already needed help with the activities of daily living get further help, especially if they were not with an agency, they had a private aid part-time, and there was no way, no central way. Especially I called dozens of agencies and trying to track down to get help. So that's an ongoing issue as well, especially in times of crisis, how to find that kind of help. And the city was like, well, there's a quarantine place, but even if they come, they need to be able to take care of themselves. Well, that's the whole problem. They can't, especially with COVID.
Right.
So,
Absolutely. I totally get that. And we are working with, we are trying to figure out how to finish out this COVID stuff that's going on. And look at all of the mistakes that were made and trying to make sure that that does not happen in the city or anywhere, I would hope, for the next, if God forbid something else were to happen.
yeah.
So I thank you for coming on and letting us hear your experience with that. I'm going to let Igor come on for just a moment. He wanted to say one last thing. And then we're going to wrap things up. We're so happy that everybody was able to come in and say something.
And Igor says, thank you. Hi again. Oh, just one more thing I wanted to say. In Philadelphia, the schools that are all over the place, they really need history on deafness, on the ADA, what that means, so that kids at a young age, especially deaf kids that are mainstreamed out there, that maybe don't even really know that signs available out there. Even if it's like a 10-minute added to the school curriculum, or somebody can go to the schools for accessibility training of some kind, that would be great. And a lot of times deaf individuals grow up so isolated, they don't even realize there's this whole deaf community out there. Even if somebody that's deaf and shows up and they get exposed to that 10 minutes of sign, it's like it's in the back of their mind. They realize this is a group I can get access to at some point. I just wanted to say that. Thank you.
Thank you so much.
Sure thing. Bye-bye.
So I wanted to say thank you to everybody who came today, all of those that are here to listen. This was a great hour of information. My hopes with all of this is just that we can all start to come together and talk about these issues so that we're all working on the same issues. Most of us are working to make things happen for our community, and all I look forward to is that we're working on it for our entire community. when we're doing things. So I want to thank everybody for joining us. Very personal experience for me. I am so excited that people are having conversations, talking about all of the different ways that we can help businesses and the city become more accessible. I find that there are a lot of things that happen that in the city that could be better. And I think one of the things that we're trying to do is the first step I think is that we have to, we've been talking a lot to the city. We tell the city all the time what needs to happen. What we're hoping to get out of these conversations and to going forward is that the city actually starts to listen to the information that we're giving them and then takes it back and does something with it, makes the changes that need to be made. And what I'm hoping with a group from the service design studio, that they are working on standards. That is something that I truly believe will help, is that there is a standard of access, and there's a standard in every office across the city on how things are to be done. Whether you're having somebody come into your office or you're trying to put something out virtually, which, you know, I fought all COVID, that there were a lot of virtual conversations that were going on that were not accessible. So how are we a part of that conversation? And these are things that are going forward. If anybody is interested in being a part of these access sessions that are going to be going forward, please make sure that you reach out to me. I will put you in touch with the service design studio, which is under the office of the chief administrator's office. And they will reach out to you about possibly being in a focus group to talk to them. Maybe some other ways that you can be a part of that. Please make sure that you also, one of the great things that you can do is that we have Amy Matheson-Millard and Adrian Ewing as part of the Mayor's Office for People with Disabilities, and they are working on these issues also. So thank you everybody for showing up today. This was an amazing hour, and I hope that this just kind of kickstarts some really good conversation. And I know that for me, I will be talking about access every day. So please make sure that you all reach out to me if you want to be a part of these conversations. And I hope you enjoy your day. Make sure that you tune in to our next Disability Pride virtual PA session, which is tonight from 8 to 9:30. It is the Transformative Advocacy, the Miss Wheelchair PA conversation. And I hope to see you all then. Thank you.